This program contains subject matter that may be disturbing to some viewers. Viewers' discretion is advised. Ryan Rutt, a loving boyfriend, an avid beachgoer, and on his way to becoming one of the leading experts in the field of physical therapy. Ryan has always stayed on top of the evidence, but that's all changed. Because of the everyday grind, Ryan fell off the evidence bandwagon and has hit an all-time professional low. This is his story, and he has agreed to be in a documentary about physical therapy. However, he does not know that he will soon face intervention.
How's it going? My name's Ryan.
Nice to meet you.
I'm a doctor of physical therapy.
Nice to meet you.
Okay, nice strip there.
Thank you.
All right. Hi, my name is Ryan, and I'm a physical therapist.
Thank you, Ryan, for coming and taking the time to meet with us and participate in our documentary here about physical therapy. So, just to start, let's just get an idea of who you are. When did you first start being interested in PT, and when did you start going to school? Where did you go to school?
That's a great question, Jay. I started PT about like 3 or 4 years ago.
Ryan Rutt, we went to school together back in the day. I mean, Ryan was, really on the forefront of evidence-based practice, and we'd go to seminars together, we'd go to conferences together.
Now, do you have an interest in orthopedics, or do you just general PT, or?
I'm pretty much an expert in all areas. I can come across any type of patient, from a 5-year-old kid to a 90-year-old person, get the job done.
So you're a patient of Ryan's?
Yes, I am.
And your shoulder's been bothering you?
Yes.
So what has Ryan been doing for you?
He kind of just rubs like a little wand thing on my shoulder, and then kind of puts like a hot pack on it, and then just kind of leaves it there and walks away.
And does it make it feel any better, or how's it?
I guess so. I don't really know.
Are you a participant in any organizations? Do you join any special interest groups? Do you have any that kind of...
I don't know. I may read like the headlines or something like that. But mainly my focus in school is athletics. We did win the softball championship about my last year.
Yes. Tell you about Ryan. I guess we can start with the positive. He is productive. He gets his units in. Gets his documentation done. He's in right at time. He leaves right on time. But not a great contributor to the quality of the clinic.
Now I'm just going to kind of move your arm, all right?
Yep.
So I just want you to let me know.
Okay. Yeah, definitely something there. Yeah, yep.
Right there? All right, hold that for a second, okay?
Yeah, sure.
Right.
Yeah.
Hold up. Yep. I know, the Bruins are terrible. All right, bye.
Yeah.
Modality driven. He gets his high reimbursement rates, but it's at a cost. Hot pack, ultrasound, massage. He'll do some manual every once in a while, but I don't know what he's doing really. I don't think he does.
All right. Okay, Mike, so just relax right here, okay? Now I just want you to relax as best you can, okay?
So what are you exactly doing right now?
Well, I'm just, trying to test like the movement of the cerebral spinal fluid in your body, okay? So just relax and tell me what you're feeling right now.
What are you trying to do?
Well,
what are you doing right now?
I'm trying to mobilize your temporal lobe of your brain.
Oh.
Yeah. So what are you giving like a pain right now?
Nothing.
Nothing. 0.
0.
It was a 4 originally?
Yep.
That's 4 units down. That's pretty good.
Yeah.
Is this the Ryan that you've always known?
I've only known him for a couple of years. He started off with some great promise.
Just talk about diagnosis, and I just kind of want to see what you do typically for different diagnoses. Okay?
Sure.
Let's just say, for example, shoulder impingement.
Yep.
Now, what would you typically do, starting from meeting the patient and kind of going toward the end? What do you do with a patient with shoulder impingement?
Probably, greet them, say hello. I would definitely go on to check maybe some of their motion, see how they're feeling, their energy levels, anything like that. Maybe doing some like trigger point release, doing some assessment with the ultrasound head, seeing if their muscles start to fire up, anything like that.
Excellent. On the forefront, he was in the front lines, really advocating so much Connor, where's your head at? Where's the evidence? And if I didn't provide it, it was, and he got upset.
What about outcome?
Well, you know, if they're just going in their day and they're just, you know, hammering away at their construction job, and you know, and they're telling me that they're feeling better, then that's all I need to hear.
All right.
Yeah. Well, they have to really believe in the treatment itself. You know, they have to trust me as the therapist, knowing what I'm doing is the best way to go.
Okay.
I have like 1 million of these. All right. So I want you to do, put that on that arm.
Mm-hmm.
All right. We're gonna try the same exact thing. You let me know how you feel.
All right.
Okay.
So, hands in the air.
Hands in the air. There you
Okay. This hurts my shoulder, you know.
go. Yeah, but we want to come up to the front like you did last time.
All right.
All right.
Yeah,
Keep coming up. Keep going.
Yeah, that kind of bothers it. Especially we've been doing it a lot now, so.
Well, you know, it could get a little aggravated.
Okay.
It takes a little while for you to get adjusted to the balance bracelet.
All
Okay.
right. All right.
Now, typically how long does it usually take you to treat a patient like this?
You know, whatever, just to get enough codes.
Alright guys, so when Ryan comes in, it's very important that we don't let him leave. Alright, we have to really just tell him, show him how much we care and how much we love him and how much we just want him to be a better PT. Alright, it's in his best interest. And then that's a good time that you guys can then bring out your notes that you wrote and then express to him your feelings.
What are you guys doing here?
Right.
Hey, buddy.
Connor, what's up?
in forever.
How's it going?
Good to see you, man.
How's it going? Jay, thought you were working today.
Oh man, I'm here
No?
for you, buddy. How you doing?
Good.
Man, give me a hug.
Doing good.
You doing all right?
Mike?
Remember me?
Yeah. How's it going?
Yeah, it could be better.
Yeah.
Yeah.
Have a seat. Have a seat.
Who's this guy?
Hey, I'm Dr. Hill.
Dr. Hill?
Yeah, why don't you have a seat here? We just want to have a little talk with you. We're all here because we care about you.
Okay.
Okay? We're a little concerned, and we just want to have a talk and get you back on the road to recovery.
Recovery
Okay.
from what?
To being a better PT.
I am a good PT.
So Ryan, here's Tom. He has just come from novice to promise, and he's here with an 8-week program to get you back.
Hey, it's good to meet you, Ryan.
Nice to meet you.
My name's Magnum Tom, and what I need to tell you about is my program. You mind if I have a seat?
Oh, no problem.
Thank you so much. I have a clinic out in Colorado, 61 days of pure heaven. What I'm going to do is I'm going to take your basics back to like the most expert level, because what I've heard about you, you're a little bit of a rut. And what I want to do is I want to implement some evidence for you, make you a better, stronger, more confident PT.
I'm not a rut.
It's not your fault, man.
Don't worry about it, man.
Just accept it.
It's no big deal.
Do you accept the just rehab that we're giving you?
All right. I'll do it.
You'll do it?
Yeah.
Oh, good.
Yeah.
Oh, man.
All right. That's swell.
Neato, gang.
All right.
We're no strangers to love. You know the rules, and so do I. I feel commitment's what I'm thinking of. You wouldn't get this from any other guy. I just wanna tell you how I'm feeling. Gotta make you understand. Never gonna give you up. Never gonna let you down. Never gonna run around.
So Ryan, you've been at the clinic for 61 days. This is your last day.
Yeah.
How are you feeling?
I don't know. I'm kind of feeling a little scared.
Why?
I really feel like I'm going to relapse.
What makes you say that?
Well, I'm having a lot of trouble choosing between like a clinical model to help me during my evaluation.
Okay, that's not something you really need to worry about right now. An experienced seasoned clinician will use the pattern recognition. So a patient will come in and immediately you'll see how they're moving and you're going to have a good idea of what to, how to treat them and what's going to work for them. You're going to read the patient really well. You're kind of starting over at this point, so there's no shame in using the hypothetical deductive model.
Mhm.
That's a long word. There's no shame in using the hypothetical deductive model.
Mhm.
For example, a patient comes in, right? Shoulder pain.
Yeah.
What do? First thing is, same thing you always do. Check the neck.
Mhm.
Make sure it's not the neck, then move on. Then so you'll just do some active range of motion, some passive range of motion,
Mhm.
some manual muscle tests, some special tests, you know, and check some other functions. Check their dash scores, you know, and see what kind of, any other kind of history they have. I mean, it's all going to help you build a picture. So as you go on and get more experience,
Mhm.
you're going to be able to see that same shoulder patient, you know, come in, and you have a pretty good understanding of what's going on even before, you know, they even say anything to you, just by the way they're moving around.
Okay.
I think you got this.
Yeah. How's it going, Mike?
Hi. Going.
Back again?
I am.
Yep. All right. So, kind of tell me what's been going on.
Same thing. I didn't get better at all playing baseball. That little bracelet, I
Oh.
threw it away.
Okay.
Yeah, it didn't help.
All right.
Didn't help. So the same issue, same thing before.
Same issue. Shoulder.
Usually, yeah, the shoulder when
Okay.
I'm throwing. You know, especially up here, I feel
Mhm.
that dull pain. deep
Okay.
in there,
Can you
so.
kind of tell me that pain on a 0 to 10 scale?
It's probably aggravated wise, maybe a 5.
Mhm.
So, yeah.
Any past medical events related to the shoulder in any way?
No,
Any recent falls or anything like that?
no,
No, nothing. Nothing else has changed.
no, nothing's changed. Just this shoulder, it gets a little more aggravated.
Does it
now.
keep you up at night at all?
I would say no.
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 Okay. Any X-rays, MRIs, anything like that?
I did get an X-ray.
Okay.
A little while ago. Can't
Okay.
remember exactly, but
I think we have that
anything.
in
Yeah. I
your,
didn't
in your
see it.
records,
Okay.
so I can take a
Oh,
look
cool.
at that
Yeah,
at a later
yeah,
time.
Sure.
Okay. Anything else? Are you taking any medication right now for the shoulder?
Take ibuprofen
Mhm.
when I know I'm going to be playing a lot.
So your goal with therapy is to try to get back to your normal activities?
The goal, just get rid of this pain and get back to playing as best as I can.
Okay. All right. So kind of want to go and start on your evaluation.
Okay.
Try to test your range of motion of that shoulder, your strength, and just to give me a better idea of what's exactly going on with the shoulder. Okay, so right now I'm asking Mike to go through cervical range of motion, just trying to clear out the C-spine. Following that, assessing his active range of motion of his shoulder. And some aptly scratch tests. Next, we're doing some manual muscle testing of the shoulder. Following that up with some different special tests, a Hawkins-Kennedy, followed by a speeds test, and then finally empty cam. Okay, next we're finally going to test the strength of the low trap and mid trap. Both seem pretty weak. I want to test your scapular rhythm, how your shoulder blade is moving.
Okay.
Okay, so what I want you to do is sit down and I want you to face that way, okay?
Yep.
All right. Okay, so I'm just going to place my hands right here. And actually, can you take your shirt off for me? Okay, good. So the next thing I want you to do, I want you to raise your right arm up and over your head, okay?
In front or?
Kind of out to the side a little bit.
Alright.
That looks good, just like that, and back down. Okay, and let's try the same thing on the other side. And one more time together, just for good measure. Okay, and back down. All right. All right, Mike, so we just finished up your examination and evaluation, so I just kind of want to let you know what's going on in my head, what I think is going on. Right now, I'm educating Mike about shoulder impingement, and I'm asking him if he has any concerns about the treatment that we're going to do.
Will I be able to throw it all, or like?
Well, what I want you to do is to pretty much cut back on the amount of throwing that you're doing. If you're throwing like 100 pitches, let's say, a day, maybe 50 so far, and less of the velocity.
Okay.
Just to,
Yeah.
I definitely
I can
have
do
to
that.
try to ice it when you're done with your activity, okay? Help reduce the inflammation. All these things are all coming back from the evidence that I was looking at over the weekend, you know.
Okay.
So
Yeah,
I
no,
can use
that sounds good.
Okay. All right. So 2 things I want to show you before you leave are a couple exercises, okay? Right now I'm showing Mike how to strengthen his low traps, which I found to be pretty weak during the evaluation. Here he's performing the W. And also we've gone to a dynamic stability exercise with the ball on the wall. So now that you have an understanding of what's going on, I want to work with you probably for the next 8 weeks, maybe twice a week, and over time we'll start building up the strength of the shoulder as well as try to reduce the inflammation. Okay? Any questions?
No, it sounds like you covered it pretty good. I mean, whatever it takes to get back and get stronger.
All right.
So
Hopefully I can help you out.
great.
All right. Good working with you.
Thanks.
All right.